For those around the table, please turn on your microphone when speaking. And for those participating via Zoom, please state your name when making a comment or asking a question and mute when you're not speaking. The MAG public comment process allows members of the public to comment on items on today's agenda or items that fall under MAG's jurisdiction. If you would like to comment at today's meeting, please fill out a white request to speak card located on the information table in the hallway and give it to MAG staff. If you parked in the garage, parking validators are available on the information table in the hallway. If you purchase a transit ticket to come to the meeting, please see staff for a ticket. Hearing assisted devices are available from MAG staff. Katie, please take a roll call. Members of the board, please state that you are here and share your organization's name after Katie calls your name.
Thank you, Co-Chair Podlager. Tish Brown-Gambino.
Here from UMOM New Day Centers.
Thank you. Jacqueline Campbell. Tad Gary.
Here.
Lisa Glenn. Oh, thanks, Tad. Tad's with Mercy Care. Sorry, I didn't see you. You just joined. Lisa Glow. Chris Hallett. Michael Hughes.
Here, a new leaf.
Natalie Lewis.
Here, City of Mesa.
Thank you. Rachel Milne.
Here, City of Phoenix.
Thanks, Rachel. Sean Pierce. Vicki Phillips.
Here, Community Bridges.
Thank you. Joan Service.
Here, Arizona Housing Coalition.
Thank you. Charles Sullivan. Joining. Danielle Wright.
Here, the Arizona Coalition to End Sexual and Domestic Violence.
Thank you. Co-Chair Rob Podlager.
Here, Valley of the Sun United Way.
Charles, not to put you on the spot, but I know you just joined.
Yes, Charles from ABC Housing.
Thank you. Back to you, Co-Chair.
Great, thank you. The next item on the agenda is a call to the audience. This is the opportunity for the public to comment on items that fall under the Continuum Care Board that are not on the agenda or that are on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience agenda item, unless the committee requests an exception to this limit. Katie, were there any comments received or anyone who wishes to offer comments at this time?
No, there are no comments received and no one in the audience to share a comment.
Great, thank you. We'll now move to the next agenda item. There we go. Our next agenda item is approval of the consent agenda. Items 3A through 3C are on the agenda for consent. Does any member of the board have questions, comments, or requests for presentation of any of these items? No? No comments? Does any member of the public wish to comment on any of the items on the consent agenda? Hearing none. Could I have a motion to approve the consent items 3A through 3C?
I move for the approval of the consent.
I'll motion.
I had a first motion from Michael Hughes. And who was the second?
It's me, Danielle.
Oh, Danielle. Second from Danielle. Thank you. Is there a discussion of the motion? Hearing none for board members in the room, we'll do a voice vote. Those in favor, please say aye. Aye.
Aye.
Aye.
Aye.
We're being
For future reference in the room, it should be an I altogether.
See, this is coming out of COVID and being in person. We have to remember how to play along together, right?
Yeah.
There we go. And so, so those opposed, please say nay. Great. For members joining remotely, I'll ask Katie to proceed with a roll call vote. Please indicate clearly how you vote, stating yea or nay after your name is called.
Tish Brown-Gambino.
Yay.
Jacqueline Campbell. Tad Gary.
Yay.
Lisa Glow.
Yay.
This is not Here, Natalie Lewis,
Yay.
Rachel Milne,
Yay.
John Pierce, Joan Service,
Yay.
Charles Sullivan,
Yeah.
Danielle Wright.
Yes.
The motion passes unanimously. Back to you, co-chair.
The next agenda item will be updates. Chairs of committees with recent activity will be asked to share updates with us. Updates will also be provided in the monthly newsletter sent out by MAG, and a memo is included in the packet for your reference. First, we're going to hear from Matthew Kelly with Mercy Care and Jusani Goodman with Phoenix Rescue Mission for an update on the Coordinated Entry Committee.
Hi, everyone. This is Jusani Goodman with Phoenix Rescue Mission representing the Coordinated Entry Committee. Matthew's not here today, so I'll be representing us. So just to give a quick update, I'll start off with our DV work group. Right now, we are working on the prioritization tool. We did receive feedback from the racial equity partners, and we were able to make some revisions based off of their feedback. And the next steps after that is that it's going before the DV managers meeting for feedback, as well as next steps for implementation. And one of the things that we're also working on is starting tomorrow, actually, we have a meeting where we're going to start conversations about a prioritization threshold for the DV survivors to be able to determine that and implement that along with the prioritization tool. We have had some individuals who have been referred. And so now it's just really a question of where are they prioritized in that, and us working towards figuring that out with DV providers as well as with the coordinated entry leads. So we also have a discussion with them to help guide that conversation along so that way there's the representation from the leads on that end. And after that, one of the other things that we're also going to do is we're going to submit that over to the lived experience committee to receive feedback from them, to be able to hear if there's any revisions that need to be made, if there's anything that we didn't catch that we can go back and amend, and be able to have, I guess you could say, the most well-rounded prioritization tool and prioritization threshold across the board for our DV survivors. The next is our homeless prevention work group update. So we're actually going to have a training on Tuesday, tomorrow as well, where we're going to be training anyone who's a new staff within certain agencies that administer the homeless prevention funding, to make sure that the criteria for the threshold is properly being used by all partners, so that way we can help to provide clarification for those partners, answer any questions that they may have. And so we're definitely looking forward to that training, so that way there's just the threshold is being used across those dollars. And then lastly, we were able to add 7 new members to the committee. So that's very exciting. Some of those representatives are jails, single providers, ESG representative, funder representative, persons with lived experience. And then we had 2 seats that expired, so we got members for that as well. One of them is the Regional Behavioral Health Authority, as well as a family provider. And so after this, actually on Thursday is our first meeting where we're going to have all those new members join us. We're hoping to do it in person. So we're kind of sharing the word to be able to see if we can get everyone in person. And also, I believe we might be able to have home base there with us, which is our coordinated entry evaluators. And so we're excited to see if we can join them, or they can join us for that meeting. But soon after, those members will receive an onboarding training. And so we're excited about that as well. And that's my update. If anybody has any questions, I can help to answer that.
Great, thank you. Are there any questions from any members of the board?
Yes, I have a question. This is Letitia from UMOM New Day Centers. Are you using any types of sample tools or examples of threshold for your DV work?
Yeah, that's a really great question. So yes, we have used some examples. I believe Danielle is here on the call. Danielle, do you mind if I put you on the spot? I know you've been working on this a whole lot more, and so your voice has been really valuable throughout all of it.
Hi, everyone. Yes, we use the DB prioritization tool from New York and took direction from that and went through each area and kind of molded it to Arizona. So you all will get a chance to see what that looks like. And of course, feedback is definitely important. And one great move that happened at the last meeting that I was able to attend was that Randy from the Family Housing Hub was definitely on board and excited to begin using the tool. So we're super excited about that. And like Jasani said, we meet tomorrow afternoon at 4 to kind of find comb through the assessment tool and get it ready to be viewed by everyone.
That's great. And has it been challenging trying to find ways to identify families, or have you all worked through that, how to identify the families?
So what was created was a spreadsheet that the DV programs are using for their clients that have been assessed or plan to be assessed at the Family Housing Hub. And that's the families that have been identified so far.
Great. So they still keep their privacy and their anonymity. Yeah. Okay.
Yes. And of course, they have the option to be entered into HMIS. We just, that's their choice. And then the workaround is not being entered, still receiving the service and being listed on this particular spreadsheet that goes directly to Solari to prioritize and see what the utilization is for DV programs to the Housing Hub.
Thank you, Danielle.
Sure.
And I misspoke earlier, I apologize, but the DV work group is actually Thursday. The homeless prevention training is tomorrow, so I apologize about that.
Great, thank you, Chisani. Are there any other questions or comments from the board? Great, with none, we'll move on. Do any other committees or work groups have an update at this time? Okay, hearing none. Thank you. We're going to move on to the next agenda item. In collaboration with the work of Pathway Homes, there have been ongoing conversations about affordable housing. Amy St. Peter, Deputy Executive Director with MAG, will give an overview and ask for feedback. Amy, I'll turn it over to you.
Thank you very much, Chair and members of the board. I'm excited to be with you today, and I offer for anyone else who's been involved in these conversations, and there are a few of you, to please feel free to jump in as well. So of course, when we're talking about homelessness, we really can't talk, we would be remiss in not talking about affordable housing as well. So homelessness and housing are incredibly connected. And in order to really reduce homelessness, we have to be increasing affordable housing as well. And so we saw this, for example, in the development of Pathways Home, our regional homelessness action plan for local and tribal governments, where we included the development of a public education campaign to raise awareness about the stigma of homelessness, but also to increase acceptance of affordable housing. So we knew in developing that action plan, we really needed to be very focused on the development of and the preservation of affordable housing as well. There are a lot of other groups who are engaged in the same line of work, and it's really important to coordinate very closely with them. So for example, in the development of that public education campaign, we were urged to partner with Home Matters to Arizona because they were developing a campaign at the same time with a number of other stakeholders. We've been doing that work with them since April, and actually Catherine Alonzo from Javelina has just presented to our management committee and to our regional council as well. And we're happy to keep you abreast of that. And really being able to invite you to the public input listening sessions has been really important because you have expertise and perspectives that really need to be incorporated into the development of this campaign. And so in the spirit of collaboration and partnership, we're also working with the Arizona Community Foundation. They have an affordable housing collaborative to help them spend down the grant that was provided by Chase to stimulate the development of and the preservation of affordable housing. And so a number of you have been involved in those efforts, and we've been looking at how do we build capacity, keeping in mind that a number of really talented partners are already working in this space. So partners like the Arizona Housing Coalition has featured this in their conference, and they've done a lot of work in this as well. There are communities that already have affordable housing plans, such as the cities of Tempe and the city of Phoenix. So we want to make sure that if we're entering into this space, that we're adding value and not noise. There are a lot of people doing really good work in this space. And the more that we talk with them, the more that we hear that there is more room for coordination and for some increased activity, particularly around capacity building. So the Arizona Community Foundation with their Affordable Housing Collaborative is very focused on capacity building, and we're wanting to help support in that space and to see how we might really leverage the great expertise of people who are around the table and who are around other tables in terms of this work moving forward. So there are a number of conferences that have already featured this topic, such as the Coalition, the League of Arizona Cities and Towns, ASU has work in this space. Vilas Health Foundation is doing fantastic work in this space as well, and just had an affordable housing institute through Corporation for Supportive Housing recently as well. So we're starting to reach out to ask people, are you already getting the information, the tools that you need to develop and preserve affordable housing? Is there anything else that you might like to learn about or participate in? And if you're not getting information at all, then what kinds of information, what kinds of formats would be most appealing to you? So I believe that you've already received a survey. We hope that you'll complete that. We're asking for folks to respond by November 30th. And your responses to that will really help us to learn from you what else is needed in this space, particularly around capacity building. So for example, are you wanting to learn more about funding and how to braid that funding, because we know that affordable housing needs to be heavily subsidized, and that funding needs to come from a variety of different sources? Are you wanting to hear about local promising practices? Vilas Health Foundation is pulling together an inventory of those promising practices right now, and we'd love to be able to share that with you and to really collectively have a really better understanding in terms of what contributed to their success, what challenges did they face, how did they overcome those challenges, in an effort to bend everyone's learning curve around the development of affordable housing. So there are also different points in the process that can be more problematic for people, and how do we overcome those challenges? How do we develop some ways to enhance the processes that are in place and be able to do those maybe in a more streamlined way or just faster and better? So we'd love to open up the floor now to see if any of you might have input to this conversation, whether you've been involved in these conversations before or are just entering into this dialogue with us today. But we'd love to hear your feedback, both during the meeting today and particularly through that survey as well. And then we'll be taking all of that feedback, sharing it with our partners. So I'd like to thank Joan for helping us out with this, and in terms of looking at how do we build capacity. We're also working with the Vilas Health Foundation, with ULI, of course, Arizona Community Foundation, and others. But would love to involve you in this experience and in this work as much as you care to be involved. So at that point, I want to pause for a moment, open the floor, and see if you might have anything to contribute. Okay, excellent. Lisa?
Well, actually, it's I might be putting Joan on the spot.
She loves that. It's okay.
Yeah, I'm hoping that we can, advocate for more funding this year, again, for the Housing Trust Fund. So if there's anything cooking there that the Housing Coalition, I'm sure, is working on, eager to hear about that.
Yes, they are the pros of advocacy, and turn it over to Joan to be able to jump in.
Yeah, no, that it is actually a great segue. So thank you for the question, Lisa. And And to be fair, I was going to jump in, but I wanted others to say or to ask questions. But I just want to say, Amy, this is the exact space where we all need to be in. Capacity building, this board and the Maricopa Continuum of Care has really, we need to build up capacity for the homeless service provider sector, as well as the affordable housing provider sector, which many are interchange. But yes, capacity building is important for this whole conversation, and we need to do it not only through funding but also education. So that's why I'm so pleased that this is top of mind, and really thank you, Amy, for leading this efforts. Yes. We are still in the logistical process of defining our legislative agenda, but I can tell you top of mind is a strategy around how can we ensure that there's more of a state investment towards not only affordable housing, but towards homeless service providers and the provision of addressing housing insecurity. So, and as folks, if they were able to take a look at now Governor-elect Katie Hobbs's affordable housing plan, there was a mention of both, all the different housing and homelessness policy levers, which includes the Housing Trust Fund, as well as a recognition of the Department of Economic Security's coordinated homeless line item. And so that's something that we're looking at to elevate at the legislature this next session. So long-winded way of saying yes, Lisa.
And this is Tad, and definitely want to thank you, Amy, Joan. I know a lot of people on here are doing great work around that concept of capacity building, which I agree is mission critical in this. And so even Amy, you going through an inventory of all the places that are intersecting or should intersect, I think is really well worth doing. And Joan, you had touched on this, and I'm just wondering, because we're in a unique time, elections just happened, and there's a lot of new people that are at the table. And so I'm assuming part of that capacity building in the plan at heart is going to have pretty heavy footprint on the legislative side, and making sure that capacity is built, so to speak. And just curious kind of what that, and maybe I'm stealing some of Joan, what you might be talking about later, but is that part of, Amy, what you guys are doing as well as that aspect?
Tad, that's a great point. And that's the beauty of working with partners, is that some partners have different skill sets and different circles where they can have more influence. And the coalition is very well poised to have exactly the kind of influence that you're talking about. So again, I would defer to Joan on that. I'm sure she's got some great plans in place.
We actually, Amy and Tad and everybody, there's a brand new makeup, a lot of turnover at the state legislature, and there's a lot of folks who are very interested in really better understanding the issue of housing and housing insecurity. And so to that point, Senator Andreas Cano in Tucson is the Senate Minority Leader, and he has committed to his caucus, the Democratic caucus, a lot of focus and education sessions around affordable housing and ending homelessness. So while things are very squishy still, I will say that, very similar to the Housing Supply Study Committee that many of you may have zoomed in or testified, it's almost like we're going to recreate that this next legislative session, because we really want to make sure housing is top of mind with these newbies, because we really want to create a lot more housing advocates down at the state legislature. So more to come, and when there's opportunities for y'all to plug in, believe me, I'll come knocking.
Perfect. Thank you, Joan. Really appreciate all of your activity and your leadership on that important work. Excellent. Any other feedback on the kind of capacity building that you'd like to see done? I know that we've talked about funding, about education, different models. pulling together kind of an inventory, and I do have one, Tad, that I'd be happy to share with you. And yeah, it's impressive. There's a lot going on in this space. So then that can be a blessing and a challenge, because there is a lot going on. And then the challenge is, how do you contribute in a really positive way without duplicating and then leaving some unintended gaps? So that's where your feedback is really important, because then you can help us to make sure that we're aligning these efforts. The Arizona Community Foundation is doing a great job, and we're very happy to partner with them on this. All right, excellent. So please go ahead and complete that survey. I know it's been sent out to you already and was presented to you in your board packet. That survey link will be sent out again. If you care to share it with any of your colleagues, please do so. We're asking for all responses to be sent in by November 30th, which is just this Wednesday. So if you can let us know, if you need more time, please do reach out and let me know, and we can extend that for you. But as much as possible, we'd love to get responses back by this Wednesday, because the next week we can really start in terms of zeroing in on what will be the first training topic. At this point, we're looking possibly at a quarterly series throughout 2023, but would love to get your input on what those quarterly topics should include. If you have any questions, any feedback, anything like that after this meeting, please don't hesitate to reach out to me. I'd love to continue this conversation with you. And thanks again to all of our partners, and look forward to hearing from you. Thanks. Mr. Chairman, back to you.
Great, thanks, Amy. Any last comments or questions from the board? Great, with none. Thank you again. And as Amy said, Katie will send out that survey again for us to complete. So if you haven't by the 30th, please do so, or let them know so they can extend that. And with that, we'll move on to the next agenda item. Michelle McGill, Human Services Planner with MAG, will provide an overview of the point in time count as well as a timeline for this year. Michelle?
Hi, good afternoon, everyone. Thanks for having me. So every January during the point in time count, volunteers and outreach teams, they collaborate to survey and count the number of individuals and families that are experiencing homelessness in our community. We use that data that's collected that day to determine how best we could address homelessness in our community. The 2023 point in time count, which is the PIC count, we love our acronyms, is scheduled for Tuesday, January 24th, from 6 a.m. to 12 p.m. We also have scheduled on January 4th and 5th, we'll be hosting a Train the Trainers with the coordinators that's assigned to each city. This will be a recorded video, and the coordinators will use that to share with their volunteers during the training. Prior to the count, they'll distribute information and documents to the volunteers. And on the morning of the count, the volunteers will go to the specific assigned area to interview people experiencing homelessness, complete the surveys on the smart app phone, and all of that will be in the training as well explained. The point in time coordinators are listed on the MAG website. If you're interested in volunteering, please reach out to the local coordinator. I will drop the link in the chat. And if you have any questions, please don't hesitate to reach out to me. I'll be happy to help in any way that I can. Does anyone have any questions?
Great. Thank you, everybody. Thank you, Michelle. Appreciate the update. Are there any comments or discussion from the board? With none, we'll move on to the next item. Cleo Warner, Human Services Planner with MAG, will provide an overview of the homelessness trends report for Q3. Cleo?
Hello, everyone. I am not sure if Katie will share the report, or Katie, if you would like me to share my screen.
Tyler's working on it. Just 1 second.
Oh, got it. Okay. Awesome. All right. So here is our homelessness trends report. If not everyone can see it, please stop me. But this is our report for Q3, July through September of this year. As a reminder, all of this information is coming from our Homelessness Management Information System, or HMIS, unless otherwise noted in here. The report is also already posted to the website, so you can check it out there. Moving to this first page. So here we have an overview of the system trends. You can see that all the changes are in numbers, which reflect the total numbers of people and those who are new to our system. You can see the details in the report with these exact numbers, but overall, we're seeing a small decrease from last quarter, starting in July and following through up to September. To note is that overall numbers are still higher than what we're seeing a year ago. So even though we are seeing this slight decrease from that spike we had in June, or like April through June, we're still much higher than what we were experiencing in Q3 in 2021. To note, towards the bottom of this page is the housing placements. Just want to point out a little bit of good news here. We are still seeing positive exits continue to go up from last quarter. So just a nice little thing to note there. Moving to the second page, we've got our demographic snapshot. So here we see more details on the demographics of who we have in our system. As usual, we are still seeing majority of male population and a disproportionate representation of Black and Indigenous folks. We see that, pretty repeatedly on these quarterly trends. We also see the majority of heads of household being adults age 25 through 61. Towards the bottom of this page here, you can see a comparison with the census data and our HMIS data. So you can reference what's in the county compared to numbers showing up in our system to sort of run a comparison there for yourself. Next, we have our subpopulations. So here, I'd like to call out a couple of things to note on this page. First, we are seeing a decline in the number of families. You see that 5% called out here in bold. This is a 5% decrease compared with Q3 of last year, so September 2021. So you can watch that line sort of decline there on that graph. Next, with older adults, we're continuing to see senior numbers at a rate much higher than last year. However, we are seeing a small dip since last quarter, so still increased 27% since September 2021. So something we definitely are continuing to keep an eye on that is very serious in our system. Then next, I'd like to go down to the veterans box, which we're seeing it pretty even from last quarter, no major changes there. Chronically homeless down at the end. Our population remained fairly steady this quarter, but it's important to note that we are still 24% higher than we were at this time last year. Moving down to our system performance measures. So as I reported, or as we all reported in the last quarter, we're continuing to see a trend in the wrong direction with a lot of these numbers. However, I did want to point out that in this quarter, we are seeing a couple of these metrics remain somewhat steady. So potentially suggesting that we're beginning to get into some sort of leveling off stage and hopefully begin seeing these numbers change in the direction that we want them to. So I will first turn your attention to this reduction in length of time homeless. This one, it's definitely trending in the wrong direction. It has added 8 days to the length of time homeless since our last quarter. And we know this is because there is a massive lack of housing in our community. We need to figure out how to get people moved through our system quicker. And that's resulting in this somewhat drastic increase we see here. Underneath that, you have the increased jobs and income growth. So while we still had a negative 5% change, it was less of a decrease than last quarter. So like I said, hopefully we're reaching some sort of leveling out pattern with that one and moving in the right direction. We have no change for the increase in successful exits, as well as the reduction in returns within 1 year. Next, this reduction in first-time homeless. Another really terrible increase we're seeing in our system performance measures. We all know that we have more people in our system than ever before, so it's not completely shocking. It's very apparent both in the numbers and when we're out in the community, as most all of us are aware. So we continue to track and work on this as one of our major points. And then lastly, this quarter, we did meet the 2021 system performance measure goal for the increase in successful permanent housing exits, which is great. So then that leaves us at just 1% away from meeting our 2022 goal of 98%. Just below this is our snapshot that shows some more details on changes over time, sort of just categorized in this little chart for you. We have on here comparisons to last quarter as well as last year. Keep in mind that this is a snapshot of just a single night. So somewhat representative in some of these, somewhat not. We have one new project added to our system this quarter. We had a CBI rapid rehousing project that started July 1st. So I know that was tons of information. Thank you for bearing through it, and I'm happy to take any questions at this time.
And this is Tad again. Definitely seeing this data is really helpful, and so definitely always appreciate that. The part that I'm just wondering is kind of the analysis of the data and what is it telling us. I'm just curious if there's some kind of broad stroke kind of analysis that could be like, I guess my concern is obviously the numbers aren't going in the direction per se. It looked like family homelessness has really improved or decreased, which is good. And what's that telling us is that whatever they're doing, what are they doing that decreased it by 2%? I'm not exactly sure what that is, because that does sound like it's statistically significant. But what is it? Just all lack of affordable housing that seems to be the issue? And I kind of have take some issue with that, because there was a lot of ARPA dollars that went out. And so I would think I would be seeing some of the data at least making some improvements, because there was millions that went. So a long-winded question, and I'm probably not kind of being too fair by throwing that out there, but it is something that getting to these details, I think, would be very helpful in being able to state if our efforts are working or not. So.
Yeah, so definitely on the whole, this tells us what is happening, not necessarily the why. That requires more investigation and digging. And if there are specifics you have on, like, why was it specifically that families dropped 5% this quarter, that's something that we can look further into and make a priority. Like I said, it's just a little more time intensive. Overall, I would say we're just seeing more people in our system than ever before. So I think this is just a reaction to us catching up to it. But I see other hands up here, and Katie, please feel free to butt in at any point. Natalie?
Yeah, my comment was exactly straight on with what Tad was just saying. I was just a little dismayed that we've got so much in federal dollars that we're putting into this work, into this effort. And yes, the need has skyrocketed too, but it does make you wonder, are we putting our money into the right things? And I do think taking this kind of information and drilling down a little bit more could be extraordinarily helpful to the region to better understand that, because if it is indeed an affordable housing type of an issue, we really need the data to show that and to demonstrate how much money we've been putting at the problem here, or the challenges that we have, and what the gap is and why we're not seeing the successes. Because otherwise it's going to look like all this money that we're investing into these programs, into these services, isn't working. And so I'm with Tad on wanting to go to a deeper level in investigating and analyzing the data a little bit more.
Thank you for that comment, Natalie. And I will say that we have started a data analytics work group specifically to address questions that might be coming from our various committees and our board and our community members of why specifically things are happening and looking this way. So we can certainly, or the board can work together to create some priorities that they might want to pull from the homelessness trends report to dive deeper into to see who we have on the analytics side to look at why certain things are happening.
Great. Cleo, let me, we have a question in the room, Michael.
It might be more of a comment. This is Michael. The question I have sometimes, and it's maybe to Natalie's point, you look at the numbers not changing much and then all the money put in. Sometimes I wonder the numbers would have been much, much worse if the money wasn't put in. And I don't know how that gets measured because I don't know if you're actually comparing statistically where it's consistent. So I'm just curious, and I don't have an answer, but I think it is worth asking the question, how much worse could it have been without the money that was used? So I don't have the answer to that. Just a comment.
I'll jump in a little bit on that. I think that the box that is highlighting to me is the box at the bottom that says the snapshot. Emergency shelter has gone up 23% since last year, and you have 2,000 more people in your system performance measures than you did a year ago. And that's saying that, and your active number is higher, but it is not 23% higher, right? So you do have kind of some of these other factors, and we can definitely dive further into some of this data, but looking year over year, your active number is relatively consistent since a year ago. It's increased slightly, but it's not that money isn't going anywhere. And I think sometimes you all forget about it because you are all in the day-to-day. But if we do take a step back, we've had a dramatic increase in the number of emergency shelter beds specifically that we have employed over the last 2 years because of COVID.
Great. Thank you. Lisa.
Yes. So along with everyone else, I have some desire that we go deeper in the data. But first of all, I think these quarterly reports, these homeless trend reports are really helpful because they're bringing up a lot of questions. My question has to do with, first of all, who is counted in this? So these are people in the HMIS system coming into the HMIS system, and then who is not counted in this? So if someone is being diverted from homelessness, which may be some of these families, they may never enter into the HMIS system. I'm speculating on that. So who does it count, who doesn't it count, what is collected, what is not collected, some of those fundamental baselines. For example, in the housing arena, how much information are we collecting on people who are being diverted from homelessness? Do they even enter into the HMIS system in the various programs? I think some of that would be very helpful, that foundational information into the report so we could ask better questions. Maybe there is a need for a work group among us on that, because I'm with Tad, Natalie, and others, that this could be really instructive in what we're doing.
This is Michael again. Is it okay? I think to Lisa's point, that really is important because going back to Natalie's comment, if we really don't understand the numbers very, very, very clearly, you're going to have people out there that will be second guessing and perhaps disappointed, in fact, in asking, where did all this money that was put out, what success has there been? And that could really pave a rough road if we really don't have a clear way of answering consistently what's been happening.
Great, thank you. Lisa, did you have anything else?
No, I don't. Thank you.
Okay, great. Joan?
I think, it's been discussed already, so I don't want to beat this conversation too much up. And just share that, obviously when we talk about the issue of ending homelessness, this is an area that has historically not seen a lot of investments at the federal or state level. And so, COVID-19, the pandemic, we had to have a pandemic to get that kind of significant influx. So I respectfully push back a little bit to Tad and to Natalie to say, it just takes time for the system to respond to. However, to Natalie and to Michael's points, I do think and to Lisa's point, I think there's, an opportunity for us to have that response. It's going to be needed when we go to the state legislature and ask for more dollars. They're going to ask, well, what did you do with the investment that came from the federal government? So I think that data will be quite helpful. But I do, this has been a topic of conversation that has historically been, underfunded. And so even with the spigot turning on with the federal funds, it takes some time. And I think the data is going to also show that. So just my 2 cents.
Great. Thank you, Sean. And then I'll go to Natalie after Sean.
Yeah, thanks. I think a lot of this is also vulnerability index. We have a huge population out there who've been supported through rent and utility assistance and through other supportive places. I mean, you talk about food banks are still seeing exploding numbers of need. That's your first indicator. And so I think if we're looking at a community index piece, we're just still seeing a trickle of those people that their needs are not being met in other ways. And so they're entering homelessness. And these numbers to me are an example of people, as was said earlier, of people who we've touched. But these are not the vulnerable people that we haven't touched. These are not the people who are on the cusp. When we start really looking at the people who are on the cusp, it's the people who are the older adults who are finding other solutions temporarily until those family members and or friends kick them out on the street or tell them to go find another alternative because they can't take care of them long term. And so I really think we need to be looking at a vulnerability index as well as new entries into homelessness, because that vulnerability piece is going to be paramount, especially as these funding cliffs approach and these federal dollars are no longer available, both on the prevention and also on the intervention side of homelessness. So I think there's a real need here for, instead of just looking at it through HMIS lens, really be looking at other indicators throughout the valley, other service providers throughout the valley, to make sure that what we're doing is coordinating all of those efforts and not just looking at it as a homelessness issue, but as a community vulnerability issue. Thanks.
Great. Thank you, Sean. Natalie?
Yeah, thank you. Really good conversation. And Joan, I sure hope that you're right and that the numbers are going to start turning around for us. But in the meantime, when in local government, our city councils look to us as professional staff to bring forward recommendations for how we're investing federal dollars. And this is nothing you guys aren't familiar with, and and I'm preaching to the choir here, but so when we're giving our recommendations, we're doing it based on not only it's the right thing to do, which is the world that a lot of our great providers live in, because it's absolutely the right thing to do, but we also have to demonstrate that it is successful and that it's a wise use and investment of any kind of public dollars, federal, state, or local dollars. And so to the extent that we can really work on this storyline will help us at the local government level really tell the story. I will tell you that before I got too deep into all of this, we always heard from our nonprofits, and we have amazing partners and amazing organizations out there doing this great work. But the politicians and the community didn't always believe it. They heard, oh yeah, it's the right thing to do. It's for people. It's good. But we have politics that go both ways, at least in Mesa. And so we kind of need both perspectives in order to really make a good, strong argument. And so one of the things I would recommend as part of this dialogue, and as we're looking at whatever data or indicators that are out there that we need to look at, is that we involve our local government subcommittee in this work. Because at the end of the day, it's those voices that are going to help sway our elected officials and help us get the monies and the investments where they need to be. So I'll get off my soapbox, but I'm really glad we're having this conversation, and I'm really glad that you guys are at least open to hearing this part of it, and that this voice is kind of part of the continuum of care. I really appreciate that.
Great. Thank you, Natalie. And Lisa, your hand's still raised?
Yes, so I just want to piggyback on a couple things. So the vulnerability index idea makes a lot of sense to me, because people going to food banks or being identified by the Meals on Wheels program, those kind of things, earlier intervention and prevention, and then having dollars during the pandemic to help those folks has been a major strategy to keep people housed. That's an area where we're going to have a major cliff and fall up in funding that I totally agree with Natalie. We can influence, hopefully, local governments to put more dollars in. Cass has a navigation center in Glendale, and one of the partners there is the YWCA. And in partnership, they have gone into the Meals on Wheels households, screen the seniors to see what their vulnerability is to falling into homelessness, to try to prevent it before it happens. And then they can get that kind of support. The same level of support is not necessarily is not available going forward. So that's an example of how that could work. And then if we understand better what worked in the pandemic and get a good narrative to create that story, I am on board with that kind of work. My second thing is around the system performance measures. I look at those and I have a lot of questions. Probably not the time to go into that now, but I would really like to have a subsequent group that or plug into one of the subcommittees where we look at that, things around the positive housing exits. I want to understand that better, and some of the other things. And are there other things that we ought to try to collect that might come, say, from the CAP offices or places that are looking at some other things that could be fed into our system performance measures? That's all.
Great, thank you. Katie?
So you all know there is a quarterly presentation that dives further into the system performance measures at the committee meeting following this meeting. So when you all get the homelessness trends report, their next meeting, they get both a homelessness trends report and a system performance measures deep dive, because they are the ones that you all have tasked with to shepherd those forward, for lack of a better description. So if you are interested, it will be recorded, or you are welcome to attend December 14th. It will be in person at MAG, or you can watch via YouTube. And then the other kind of pitch I will give, for lack of a better description, our staff is happy to meet with anybody at any time to dive further into any elements of this report or to dive further into the system performance measures. So if anybody is interested, feel free to reach out to Cleo or myself and we can get that set up with you.
Great, thank you. Are there any other comments or questions from the board?
Sorry, just this is Joan again. One more question or comment. Katie, yes, right? Like, thank you so much for opening that invitation for the board members to dive in. But I think as a board and as the many different committees that MAG convenes around this issue, it would be helpful for, God, I don't want to create more work for anybody, but like a committee to look at the narrative that comes out of this, right? Because I think that's what we're all to help Natalie and Tad and Lisa and myself and everybody we need to have a collective narrative. So that's what I feel like might be missing.
Yeah,
I
thanks.
mean, data is important, right?
We actually have a communication work group. They took a brief hiatus during the NOFO. I will hold full ownership for that, with our staff being all new during NOFO, but they will be reconvening in the coming months. They're the ones that created the homelessness trends report data page on our website. So there is a full page you can go to find this report, find some top 5 takeaways from the report. They were the ones that drafted it and brought it to you back in August last time the trends report was brought to you. They're also going to be in the process of drafting an entire communications plan of how communication goes across the continuum of care groups into the continuum of care and then out. So they're working on that. I will say it is definitely something that we are in the process of. And if anybody's interested in joining that, please reach out to me. We are happy to get you added to it.
Great. Tad?
Yeah, just one thing again, and really appreciate this dialogue and really helpful, and hopefully my initial discussion didn't turn anyone off by any means, but because I know there's so much great work going on. I think my original point too is just that analysis and being like, who does do that on an ongoing basis, and what does that look like, and how should that be informing our decisions about the board or as a board, that true, seeing the data and then analyzing it and having that. So more than just the communication part of it, how we communicate, but kind of that action activities off of, or, the analysis, and then which leads into the action. And I think it's that analysis that I think would be really helpful to understand moving forward. And I recognize there's a year-end kind of process to this, but an analysis of sorts would be really helpful moving forward. So
Great. Thank you. Any last questions or comments from the board? So in summary, I think we do have some opportunities in the next couple of weeks to learn more, to dive into it more. What I did hear in the conversation today, though, also, Cleo, is that people are hungry for the information. So please understand, by presenting the information, it is in full support of what's being provided. And we know that there's a lot of work that you and the team do to be able to pull this together, along with Katie and the rest of MAG. So thank you so much for presenting the information to us today, and we look forward to future conversations.
Wonderful. Thank you all for the input and insight.
Great. So now we're going to need to go ahead and could I have a motion to approve the quarterly homeless trends report for quarter 3?
Specific motion to approve the quarterly trends report.
Great. Thank you, Vicky. Can I get a second?
Second, Tad.
Tad? Thank you, Tad. Appreciate that. Is there a discussion of the motion? With none, for board members in the room, and we were instructed how to do this, we do need to have a voice vote. So those in favor, please say aye.
Aye.
Great work, friends.
Those opposed, please say nay. Great. Hearing none. For members joining remotely, I will ask Katie to proceed with a roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
You, Co-Chair Podlager. Tish Brown Gambino.
Yay.
Tad Gary.
Yay.
Lisa Glow.
Yay.
Michael Hughes. Oh, you were in the room. Natalie Lewis.
Yay.
Rachel Milne.
Yay.
Sean Pierce.
Yay.
Joan Service.
Yay.
Charles Sullivan.
Yay.
Danielle Wright.
Yay.
The motion passes unanimously. Back to you, Co-Chair.
Thank you. Now we'll move on to the next item. Do board members have any action or discussion items for future meetings? Hearing none. For this next agenda item, comments from the board. Is there anyone on the board that has any other announcements or events that you would like to highlight?
have a comment. You have a board strategic planning session coming up, December 19th, 9:30 to 12:30, in person only. As much as I would love to torture you with a 3-hour Zoom, it'll be held right here in this room. Looking forward to it.
This is Joan. Just wanted to highlight for folks that our conference registration is open. Early bird registration ends December 16th.
I don't know if this is for Rob or for Katie. There was discussion, Natalie had brought up an idea of at least a quarterly meeting of people in attendance. So I'm just curious what kind of progress or should there be discussion for that in a future meeting?
Great. So we did provide a recommended calendar for 2023 calendar year. And so we're going to do one in person per quarter, and then the other two will be remote. So the first one will be in February.
And I will just say, Rob and I tried to be intentional with those February, May, August, and November. Those are typically your longer board meetings too. So you have the homelessness trends report, like this conversation in those meetings, as well as some other things. And we will be sending a calendar invite shortly and making it pretty clear. Like I will have those meetings as separate invites from the other one, but please block off time for travel if that is necessary for you.
Great. Thank you. Any other announcements or events anybody would like to highlight? Hearing none, with no further business, this meeting is now adjourned. Thanks, everybody.
Thank you.
Thank you.